It's Dr. Emer. We're in West Hollywood, and we are doing a little bit more BOTOX injections today. And remember, it doesn't matter what you call it. It could be BOTOX, dysport, Emer. All of the companies have a similar freezer or neurotoxin that's used to basically suppress wrinkle formation. So you have my young patient here. Squeeze in your brow a little bit. So you can see very minimal wrinkles there. Raise up as high as you can. Very minimal wrinkles there. Smile as big as you can. Not that many wrinkles, relax, because we've been doing constant treatment over the past few years. His skin texture quality is looking good. He doesn't have many dilated sweat glands. The redness has gone down. All those things improved with using BOTOX, dysport, or Emer. So in the glabellar complex here, we like to keep male BOTOX to where the brow is horizontal. You don't want to elevate the brow too much like this laterally and make it look like a gull wing or an arch, because that gives guys a Spock effect, and it also makes them look feminine. So we're going to keep him looking a little masculine by focusing in just the central part of the glabella. So squeeze in again. You can see, relax. He doesn't have much movement there, much wrinkles, because we've been very good at doing maintenance treatments. But we're going to focus right here in the procerus, right in the middle. To the side of that is the corrugators. I'm going to go on both of those. And then with men, we're still going to go a little bit more laterally to the mid-pupillary line. Give that nice corrugator injection, stay low, and we're done. That's perfect. That focus is just on the 11 lines. Now what we're going to do is we do a touch-up for his forehead. And this is where it's really important to go to someone experienced, because raise up a little bit. You can see he's got a lot of movement up here, but he also has wrinkles down here. So you have to be super careful. You don't want to overdo it down here and then get wrinkles up top. So what we're going to do, raise up again, relax. We're going to focus on just the central line, very small bits. We're going to go all the way across, a couple units of spot, raise up again, good, relax. Raise up again, relax. Turn to me, raise up, good, relax. Raise up, relax. Now with him, he's got a lot of movement laterally, so you have to be careful. You want to make sure you're doing some injections. Now laterally, we're going to go up high and do a couple pokes along his hairline to make sure we keep it all real even. Okay, now raise up again. You see where he's got this crease here, relax. We're going to put it just a couple units a little lower to balance this so that he doesn't have that line there. And then we're going to come a little lateral and make sure he doesn't get a Spock effect. So that really should, raise up again, relax. We're going to do 2 more up here. Give him what he wants in a micro droplet fashion and even it all out. I think that'll be great, and that'll be a good maintenance treatment so that it lasts much longer. Now the eyes, turn all the way here, smile as big as you can. You can see the muscle goes all the way around here from the edge of the brow down. So for him, we're going to use dysport here, and I'm going to do it right at the lateral edge. We're following the lateral canthus and doing a larger injection amount here in the center, because that's where the majority of his wrinkles are. But then smile again. Smile, good. We're going to go a little bit above and a little bit below to balance it out and blend, because that's kind of where his wrinkles form. Come back out here, we're going to go the opposite side. Smile again as big as you can. Turn it a little more. There you go. Now over here he has a little less movement, so we're going to focus where he's got the movement. And again, a little larger bleb in the middle. Come up a little bit higher, a little bit lower. Smile as big as you can. Good, relax. We'll do a little bit closer here to the eye. On both sides, smile again. There's a little bit of movement right there, so we'll come across here and just do a small bit. And that's it. And that's perfect. So that is our male BOTOX preventative treatment for movement wrinkles. Remember, this is not a filler. This paralyzes or weakens the muscle so that wrinkles don't form over time, decreases oil production, decreases redness, helps acne, and also softens sweat glands in the area so the skin looks smoother and tighter as well. Thanks, guys.